The topic for this presentation is how to navigate and get a diagnosis and receive treatment for individuals with autism spectrum disorders and other developmental disabilities. If you have a concern and are looking for an evaluation and possible diagnosis, it is important to look at your health coverage to see who can do the diagnosis and what is actually covered. Here are some listings of private health coverage in Washington State. Most insurance companies require a specialist, a board-certified neurologist, board-certified psychiatrist, licensed psychologist, or a board-certified developmental pediatrician to do the evaluation and give the diagnosis. It is critical that you check your insurance policy for language addressing in this area. It is also critical to voice your concerns to your pediatrician, and they may assist you to find out who would be best to give a referral or to perform the evaluation. If the child is covered under Washington Apple Health and has one of the examples of the managed care organizations listed here, then the process is a little bit different than private insurance. We will be going over this process over the next few slides. Under the Apple Health Plan, an individual must get a diagnosis from someone who's licensed under Title 18 RCW. It can be a neurologist, a pediatric neurologist, a developmental pediatrician, pediatric psychiatrist, or psychologist, and they must be experienced in the diagnosis and treatment of autism and use a validated diagnostic tool. Along with those previously listed, a Washington State Center of Excellence, or COE, can give the diagnosis and prescription under the Washington Apple Health Plan. This is a designation created by the Washington State Healthcare Authority and can be a hospital, medical center, or other healthcare provider that meets or exceeds standards set by the agency for specific treatments or specialty care. In this program, the COE performs the clinical diagnostic evaluation and determines whether ABA services are medically necessary for an individual patient. COEs are commonly psychologists, pediatricians, or nurse practitioners. Once you have a diagnosis that is approved through your insurance, the child may be prescribed more than one treatment service, depending on their individual needs. This can include speech therapy, occupational therapy, physical therapy, or other medical treatments for co-occurring conditions. Another scientifically validated form of treatment is applied behavior analysis, ABA treatment. ABA has been covered as a medical necessity treatment for the autism spectrum disorder and other developmental disabilities for which ABA has been proven effective. The Washington Apple Health Medicaid plan has covered this benefit since 2013 and other private carriers in Washington State since 2014. Since it's still a relatively new benefit, policies continue to be modified and updated. It is important to speak to your insurance carriers to see if any changes have been made. The purpose of Applied Behavior Analysis, ABA, is to assist children and their families to improve the core symptoms associated with autism spectrum disorder or other developmental disabilities. ABA supports the learning, skill development, and assistance in many different areas, such as social, behavior, adaptive, motor, vocational, and cognitive. As you can see, it is a very comprehensive form of treatment. For a child to access applied behavior analysis, they must have a written order or prescription for ABA services that includes the diagnosis from a COE or other approved provider. You must note that this provider cannot recommend ABA services, but must have the words order or prescription, or else the insurance company will deny this form of treatment. After they have the written order of prescriptions, the family will be given a list of ABA providers. If you have a challenge in securing coverage for prescribed ABA treatment services, you can contact Northwest Autism Center or the Washington Autism Alliance and Advocacy for assistance. The next step is for the family or caregiver to select an ABA provider. An ABA provider must be a Washington State Department of Health licensed behavior analyst, an LBA. LBAs in the state of Washington are also Nationally Board Certified Behavior Analysts, a BCBA. The LBA completes a comprehensive assessment with the child and the family to determine the strengths and needs for treatment. Then, an outcome-oriented, time-limited ABA treatment plan is developed, including the hours of treatment per week. Once the family has reviewed the treatment plan, agrees, and signs, it is then submitted to the insurance for prior authorization. Once approved, services would be initiated and reauthorized every 3 to 6 months. So where is ABA treatment provided? ABA treatment can be provided in many settings. Both at Washington Apple Health and private insurance carriers cover treatment to be provided in the home, community, or clinic-based settings. Typically, 5 to 25 hours per week of treatment is given, depending on the assessed need, treatment plan, and recommended dosage. The Washington Apple Health Plan also has an added benefit of a 48-day early intensive applied behavior analysis day treatment program. For more information, you can visit Northwest Autism Center or the Healthcare Authority. Finding ABA services can be challenging. The demand for ABA services currently outnumber the qualified providers available in Washington State. However, each year the provider pool continues to grow as university programs expand learning opportunities and board-certified behavior analysts relocate to Washington State to practice. It is critical to view updated lists of local ABA treatment services and to seek other resources such as early intervention or other treatment services, even if you're waiting to access ABA treatment. For more information about the ABA benefit, you may email the Healthcare Authority at aba@hca.wa.gov. On their website, they also have a list of COE and ABA providers from across the state. You may also contact Northwest Autism Center to assist in navigation of finding these services, particularly for approved list of COE and ABA providers in the Spokane area as well as Eastern Washington. If your child is under the age of 3, you may seek out other early intervention services. You may contact your local school district and ask if they're having a child find or request that they evaluate your child for services. You may also contact the Infant and Toddler Network, in which they conduct free developmental screenings and also provide early intervention services and give information on providers. Our community strives to provide supports and services to families caring for a child with autism and/or other developmental disabilities. These supports and resources include Developmental Disabilities Administration, DDA, the ARC's Parent-to-Parent, PAVE, Autism Society of Washington Spokane Chapter, the Isaac Foundation, and Northwest Autism Center. Thank you so much for taking the time to view this training. If you have any more questions or need further assistance, you may contact Northwest Autism Center at the information listed here.